My name is Willard Robinson. I've been with the health system for 20 years. I started off in housekeeping and I'm end up in transport. And I've been looking forward to Dr. Popovich come and walk in my shoes and get the same experience that I get and the same enjoyment that I get.
If you ever wonder how patients get from here to there and get there on time, it's because of people like Willard to really be able to make that all happen.
Yeah, I come in early, watch the news, trying to see, keep up on current events, and that way I can share with my patients, or they can give me ideas, we talk, because I'm more like a people person.
So Willard, let me ask you a little bit about how you ensure patient quality and safety.
First, I check with the nurse, make sure I got the right patient, check the chart, make sure I check my pager, because some of the information is on my pages, make sure I got the right patients, I check the armband.
We went through a lot of the AIDIT training, where we actually acknowledge the patient for with their name, we introduce ourselves, and we explain how long it's going to take to say do what we're doing, say transport them, an explanation, thanking them. Do you try to follow that? Has that been helpful?
Oh, I follow it every day with the best of my ability.
Yeah.
And hey, I enjoyed it, and I think I was doing it before the AIDA came out.
You probably were.
Another thing is make sure you explain to the patient everything you're doing. If you don't explain it to the patient, that's not right, because they're not expecting that, and sometimes they get a little testy about it.
Great part of AIDA training.
Yes,
too.
it is. You have to let them know.
Excellent. You have to have challenges too. Tell me about the challenges of being a transporter.
Getting on the elevators, getting down the hallways, it's multiple.
No, hallways have to be difficult to navigate, especially in the morning when you've got a lot of the doctors and the nurses and the computers on wheels, and it's got to be a challenge.
Oh, it is a challenge.
I'm so proud of what you do and how you conduct yourself.
Well, thank you. Well, all I do is want to treat people like I want to be treated. I treat nobody no different. I try to do my best I can and make the patient feel comfortable, even family members.
Individuals like Willard, who are part of the fabric of Henry Ford Hospital and will be part of the fabric in the future as well, are really the heart and soul of what we provide to patient care. Many people don't see the work that our transporters do. They do when a patient doesn't get there on time, or if they feel as though the transporter is a nuisance to them in some fashion because they're going down the hallway. But they do their work so extraordinarily well, and they do it in a fashion that keeps patients caring and comfortable in the time in which they're under their watch. And I want to thank each of the transporters for what they do. They embody the AIDIT approaches in keeping patients comfortable and communicating with them. They really keep patients safe during that important transportation that can be fraught with a lot of danger and injuries. And they do it really with patience, caring, and with a bit of humor. So thank you, Willard, for being a part of Walk in My Shoes on Doc and the D.